About 20% of the population suffer with reflux. So the likelihood that you know someone or experience it yourself is pretty high. Welcome to Health by Nature. In today's video, this is what we'll be covering. I'm Sheridan Genrich, clinical nutritionist and naturopath, and I want to thank you for taking the time out to join me. Sometimes called GERD or gastrointestinal reflux disease, acid reflux or heartburn. All of these are a cluster of symptoms that can include the most common things that I'll go through in a minute. Can be a chronic dry cough, clearing of the throat, especially after meals. That typical sign of significant acid coming up after eating. Or at any time of the day, even it can come up. Difficulty swallowing, shortness of breath, a sour taste in your mouth, frequent burping, and pain in the stomach as well. Now, these symptoms, you can have one, two, or all of them. And there is also another type of reflux called silent reflux that doesn't give any symptoms, but it does cause the irritation, and eventually some symptoms will come along with it. So low stomach acid is one of the most common causes of indigestion. The most common reasons for this are the low levels of B12, especially important if you're a vegan or vegetarian, low levels of zinc, something called SIBO or small intestinal bacterial overgrowth. And the other one often forgotten about is emotional stress. So in our nervous system, we have parasympathetic and sympathetic automatic nervous system. And it's basically a survival mechanism. So you can't run away from a tiger and eat at the same time. And this is a big one and one of the most challenging causes of indigestion. So if you do have this and it's been going on for a very long time, it needs the same amount of time to heal. So here are a few natural remedies that I'd like you to experiment with if you're dealing with indigestion or reflux. So apple cider vinegar can be taken to help stimulate the natural hydrochloric acid in the stomach. Take a tablespoon just before you eat with either a little bit of water. You could mix it into your food or have it during the meal. I don't recommend drinking or talking heaps and taking in lots of air while you eat, as this will also affect stomach acid. And if you feel like this helps, well then it's only a mild version of reflux at that point. Another one I clinically use a lot is herbal bitters. So specific herbs can stimulate and strengthen your digestive fire in your stomach. This will also help you prevent further worsening in your small intestine and parasites or bacteria. You know, they should be destroyed in the stomach acid if it's strong. The other one that is often used is betaine HCl. HCl stands for hydrochloric acid, and this is literally taking something that will be produced rather than the body doing it itself. And you can take it also just before or during your meal. And it's a little harsher, so try the other things first. Now, one of the common things that I see in clinic is patients coming in that are actually already on proton pump inhibitors. So that's the acid reflux blocking medications. Now, these medications may make you feel better in the short term, but sometimes they come with side effects and consequences that often aren't told to people when they're prescribed or they buy these over the counter. So the truth is that these antacids can actually cause nutrient deficiencies, increased risk of infection, because again, you're not having that barrier there to protect you. And small intestinal bacterial overgrowth is another common one I see, as well as bowel movement issues can come from the antacids, and it's not a clear immediate signal, so people don't notice there's a connection. So that's right, the medications that are trying to help relieve and maybe giving you short-term relief may actually be causing other digestive issues and immune system issues. The immune being a really important one we all know about right now. So these medications are also rarely the answer the question as to why you actually have reflux. So just be aware that that's going on, and there are other things you can try, and please seek professional advice if you are attempting to try and come off any types of medications or change what you're doing. It's always best with someone that knows exactly what they're doing. So I hope this has helped. Please share and like it if you have gained something from it. And just make sure I'll give you a little tip as well before you go. Now, the reason we want good stomach acid isn't only from bacteria, but also to help us digest protein. So when we don't have good stomach acid, we actually don't get the benefits from the proteins and the amino acids that repair and rebuild and build our neurotransmitters. So I just wanted to not forget about that little one, which is quite important. We need strong stomach acid. And please just share this and like it. And we really want to hear some feedback about what you're gaining and liking from these videos. So thank you again for your time, and we'll talk soon. Bye.